It is the 24th of March 2020, in the very early stages of the COVID epidemic in the UK. And this is a training video being made for the heart attack team and ambulance crews bringing heart attack patients to Frimley Park Hospital in Surrey. Frimley Park Hospital is a moderate-sized heart attack centre treating 200 to 300 primary PCI patients a year, and we are expecting to be busy during this epidemic. The lockdown in London began today, and so this video is being made with a few bits that I had lying around. This is the normal layout of the lab. Ambulance crews bring the heart attack patients to a Ppci entrance at the back of the hospital, and patients are taken down a corridor and into the catheter lab, where the patient is then transferred onto the operating table. The cath lab team consists of a consultant cardiologist and a senior nurse who stand by the side of the table. A CCU nurse is the runner nurse during the procedure. There is a radiographer at the end of the table and a cardiac physiologist in the control room to monitor the procedure carefully. During this training video, full PPE or personal protective equipment will be represented by these long red tubes. The consultant and senior nurse assistant will be wearing sterile full PPE, which is designated by these yellow squares on the red tube. Half PPE or basic PPE is represented by the shorter yellow tubes during the video. As part of the normal protocol, during a Stemi, the ambulance crew contact the coronary care unit, who then speak directly to the consultant and transmit an ECG before activating the heart attack team. During the COVID epidemic, the coronary care unit will ask specific questions, some of which are already asked. For example, the temperature of the patient, the respiratory rate, oxygen saturations, and other factors which might place the patient in a high COVID risk category. For example, is the patient self-isolating? Has the patient had recent contacts with COVID positive patients? The ambulance crew bringing the suspected COVID patient with the Stemi will give the coronary care unit a 10-minute warning before arriving at Frimley Park. They will then wait in the ambulance with the patient for the CCU nurse, also dressed in PPE, to make an assessment of the patient. Meantime, the rest of the heart attack team will place a barrier between the lab 1, make sure that the positive pressure ventilation has been switched off, and be fully dressed in PPE after making sure that PPE has been placed in the sluice, which is just outside the cath lab in this area here. Once the cath lab are ready, the patient will be brought through the Ppci entrance by the ambulance crew and the CCU nurse, all dressed in full PPE. Stop. Once the patient is in the cardiac catheterization lab, there is a full handover. The patient will be transferred onto the table. The temperature of the patient will be checked, and a mask should be placed on the face of the patient. After the patient is transferred onto the table, the dirty trolley is brought to the door, and the ambulance crew doff in the catheter lab, moving into the sluice, only wearing their masks. The ambulance crew then change into half PPE or basic PPE, which involves a surgical mask, an apron and gloves. The rest of the heart attack team are still in full PPE, and the consultant cardiologist and his senior nurse assistant are both in sterile full PPE at this point. The trolley is still in the cath lab. The ambulance crew move into the hallway, and the dirty trolley is transferred out of the cath lab and into the hallway. The ambulance crew then leave with the dirty trolley, the door is shut, and the primary PCI is underway for the Stemi patient. At this point, this ambulance leaves, the doors are shut, and the PPCI is being undertaken by the team. After the procedure, the patient is transferred onto another trolley. At this point, the whole heart attack team are still in full PPE and in the cath lab. Using a buddy system, they must doff in the cath lab, then move into the sluice area wearing just their mask. They remove their mask in the sluice area and wash their hands thoroughly as part of the doffing protocol. Team members involved with transferring the patient to the coronary care unit or another COVID positive area for suitable monitoring must then dress into half PPE. The only exception for this is if the patient is intubated and ventilated, in which case the team members transferring the team have to be in full PPE. Assuming that the patient is not intubated, the patient is then transferred by two members of the team wearing half PPE. The remaining members of the team doff in the cath lab and move into the sluice wearing just their masks. The masks are then removed in the sluice, and after washing, the remaining members of the team can leave. Finally, team members still dressed in half PPE should clean the cath lab as normal, but also the hallway extending all the way back to the PPCI entrance. Various items of PPE that have been taken out into the sluice and scrub areas need to be returned to secure storage.